So the rest of today, we're going to focus on actual adaptations that occur in the cardiovascular system as a result of aerobic training. And so for this lecture and the next one, we have the exact same outcomes. And so just tie this into each of these lectures specifically. So ultimately what we're doing is we're making changes to the cardiovascular system with aerobic training. And this three areas that we can change or improve are heart size, stroke volume, and heart rate. And there are more than this. We're going to talk about more on the subsequent lecture. So heart size, I want you to look at this picture here, this little diagram that I did not come up with. I stole it from my master's advisor here. But what's different between the two hearts, okay, or the two circles, I guess. All right, and so there's two things that actually stand out, okay, and so LV stands for left ventricle, and so with aerobic training, the amount of muscle in your heart increases, and it causes left ventricular hypertrophy, all right, and so what happens is, one, the chamber size increases, so notice that the size of the pale red is bigger in the one on the right compared to the one on the left, and then what also the benefit of this is that we're going to be able to fill it up with more blood. And one of the things that will happen is that we're going to have an increase in filling time because heart rate's going to be reduced for a given workload. And so having a bigger chamber, it can hold more blood. And because there's more time to fill it up, that's also going to help. And so we're going to be able to fill up with more blood and then eject more blood with each contraction. Additionally, you get this this eccentric hypertrophy, so that's what we just talked about, and then you get this concentric hypertrophy. And so the other thing is that you get the thickness of the walls changes. So look at the thickness of this wall relative to this one, right? So this one over here, the dark red outer border, it's darker, or it's not darker. I mean, it's thicker, and so as a result, or the way this happens is there's more actin and myosin. If you have more actin and myosin, more cross bridges, more force, greater stroke volume. And then, so we take those two things, and that helps contribute to the increase in stroke volume, right? And so all these changes are kind of interrelated here. And so with stroke volume, if you notice that as intensity increases, stroke volume increases ultimately until it plateaus. Now notice, one, that for a given intensity, training results in a higher stroke volume, but two, notice that before training, stroke volume plateaus much earlier in a much lower value. So this is probably what about 110 right here, where we plateau, and then up here it's about 150, and so that's an increase of almost 30 to 40%. So that'll make a huge difference. And so when we change, or when stroke volume's improving or increasing, it's multifactorial, right? So increased blood volume that we'll talk about in the next lecture, the volume of the ventricle, in other words, how much blood the ventricle can hold, is larger. And then the fact that we've got more actin and myosin, more cross bridges like we talked about on the previous slide, that will allow the heart to contract harder so more blood gets out. Now, an additional adaptation relates to heart rate. And so with resting heart rate, that's reduced after endurance training. And this can often result in something called bradycardia. And so bradycardia is usually, you hear different definitions, but generally if your heart rate's below 50 beats a minute, you're experiencing bradycardia. Now this happens to many of us frequently, especially when we're sleeping or at rest, right? Your Apple Watch goes nuts and says, hey, your heart rate fell below 50 or 40, depending on what you've got your alarm set for. And if you're resting, that's not necessarily a big deal. Happens to me fairly frequently. And I know that I say it a lot because I've been made fun of, but it's just one of those things that happens, right? So, and it's probably a result of genetics and the fact that I run a fair amount. Okay. Now, how does this happen? Well, more likely than not, it's that you've got higher people that have this bradycardia have a higher level of parasympathetic activity and a lower level of sympathetic activity for a given intensity. And so the other thing that happens, which is really interesting, is that the intrinsic firing rate of the SA node is reduced. Okay, and so instead of maybe going at 60 beats a minute or 60 times a minute, maybe it's 50 or even lower. All right. And so as a result, what happens is heart rate for a given intensity is lower after training, excuse me. And so again, we see that with this figure here. And what's interesting is that if you look, the difference between training and non-training gets bigger as intensity increases, right? So you look here, right here. Notice that they're pretty close to each other, but by the time we get up to max, this difference can be, 20, 30 beats a minute. And that means that you've got a lot of room to improve. Okay. But the important thing to know is that cardiac output remains constant, right? Ultimately, the goal is to deliver a specific amount of oxygen. And so if I can deliver a specific amount of oxygen, it will take a specific cardiac output. And so by lowering heart rate but increasing stroke volume, I'm becoming more efficient with that. Now, what's interesting about training, and we can see that from this picture here, is that max heart rate is either unchanged or maybe even slightly lower. Okay, and we're going to get into why that might be, why it might actually be a little bit lower. All right, but for the most part, just training doesn't affect heart rate max. All right, we talked about this a few minutes ago, but as we increase heart rate, that's going to decrease filling time. Okay, if I have decreased filling time, that means my stroke volume is going to be less. All right, and this could be what causes the decrease in heart rate max. You just get to the point where you're not able to compensate for that reduced filling time. You're already pumping out so much blood. If we go back to this figure here, okay, actually I'm going to go back a couple here. So this person, when they plateau, they're about 150 milliliters per beat, whereas before they were trained, they were at 110. So they've increased their stroke volume by 30-40%. And it's hard for your heart to compensate with that with the decreased filling time. Okay, but ultimately, even if you have a slightly lower max heart rate, you're still much more efficient after training than you were before training. So it's like, hey, I'll give up a couple of beats per minute, but I'm delivering 40% more blood per beat. And then I think the last thing that we're going to talk about here is heart rate recovery. And so when we talk about heart rate recovery, it's just how long does it take your heart rate to get back to normal after you exercise? When you train, or after you become a trained individual, the recovery happens more often or more rapidly. But there are some things that can delay it. So higher core temperature, remember that speeds up chemical reactions. And if you've got lots of chemical reactions going, that's going to speed things up, including your heart rate. And just the fact that you might have increased sympathetic activity. But we can see this here, and you can actually, this is another one of those things that smartwatches track, is just how long it takes. And, if we see from this figure here, after training, it gets back to normal pretty rapidly compared to before training. So, and I will let you know this is going to be the same kind of check your knowledge slide at the next one, but what are 3 cardiovascular changes that occur as a result of aerobic training, and what are the benefits of those changes?